Well, for all of us who have loved Scandal, we have had an emotional roller coaster ride with the First Lady, Mellie, and everybody agrees whether they love her or hate her. They love the actress that plays her, Bellamy Young. And excitingly, she is with us right now, along with a leading oncologist, Dr. Suman Rao. And we're talking about something very, very serious and very near and dear to your heart, Bellamy. It's lung cancer and genetic testing, correct?
Absolutely. I lost my dad to lung cancer in 1985, and it was such a different climate back then to get a lung cancer diagnosis. And it was a very, very ravaging death and a very debilitating treatment. And that is why I'm so grateful that we have the opportunity to have partnered with Merck and 6 beautiful lung cancer advocacy groups to have created the campaign and the website TestTalkTakeAction.com, because so many advances have been made in the very recent past in terms of lung cancer treatment. There's a thing called biomarker testing now. You know, every cancer is different, and there are things called biomarkers, which are the little clues on the tumor which tell your doctor exactly what kind of cancer you have so that they can tailor their treatment exactly to you. And on the website, people can learn about biomarkers. They also can print out a page to take with them to their doctor's office when you get that scary diagnosis, when you're in that room, a list of questions that you want to have prepared to ask your doctor and a place to write down the answers, because it's too frightening to take it all in right then. You want to be able to review it later with a clear head. And on the website, people can also learn about these wonderful lung cancer advocacy groups, because I know we felt very alone when we were going through this process, and I just want everybody out there to know that there is either real and or virtual community that will be with you 24/7 to support and love you through it.
That has to be so incredibly helpful. Doctor, what are some of the changes you've seen in the treatment over the years, and in this testing, how does it benefit patients?
Oh, I've seen a lot of changes over the years. For one thing, lung cancer is a disease that impacts a lot of people. It's nice that the incidence is actually going down because patients are smoking less. So that's, of course, a very important part, is to quit smoking as early as you can. So I do tell the story that in my fellowship, we had a professor who actually argued that we should never treat lung cancer patients. But now we have such amazing treatments, and biomarker development has been one of the most exciting things during my work as an oncologist. And having these biomarkers help us, these biomarkers are substances that are found on cancer tissue, and it helps us determine what patients would benefit the most from. For example, for lung cancer, we have the EGFR testing available, the ALK and the ROS testing, and if any of these are positive, we can use drugs that specifically target these mutations. The most recent development has been with immunotherapy, which has been very exciting for me. And immunotherapy is basically drugs that help stimulate the patient's own immune system to fight the cancer. And the PD-1 and PD-L1 pathways are very important in this. So testing for PD-L1 can help us determine which patients probably would benefit more from the treatment. So it's a lot of information. If you go to this website, TestTalkTakeAction.com, patients can actually find information there that helps them. They can understand more. They can take this information to their physicians. As Bellamy was saying, the first consultation, that meeting with the physician to talk about treatment, can be very scary and very confusing. So having this material can empower the patient to discuss what treatment is really appropriate for them.
And that's just a lot of information, so I'm glad you did give a website for folks to visit, TestTalkTakeAction.com. Bellamy, for you, using your fame to be able to spread the word must offer you at least some sense of just consolation. I'm so terribly sorry for your family's loss, but you know, where are you even finding the time? Because I know that you've got the TV show, you're a singer, a producer, you do so much, but you obviously make time for this.
Oh my goodness! I mean, it means so much to me to be having these conversations, and I'm so appreciative of you taking the time to talk about this, because we never know who's watching, and they might go to the grocery store and get the information to the right person. And any little help that I can be to get that ripple effect out there, I just want everybody to know that recently there have been such wonderful advances, and we have so many more options. And I just encourage everyone to go to the website testtalktakeaction.com and then have a wonderful conversation with their doctor and get the very best treatment they deserve.
Well, I hope that's exactly what will happen. And thank you, ladies, both for joining us today on River City Live. We appreciate it.
Thank you for talking to us.
Thank you.